Hi, everybody. Judy Seeker here, back with another episode for the Ozone Therapy Masterclass. So happy to have all of you on here to learn the deep dive truths about ozone therapy from our experts. And today is absolutely no exception. I'm super pumped about this expert talking about something that many people do not know about. So again, we're going to deep dive, get the big picture, understand what it's about, whether you're looking as a patient client, looking as a practitioner, this is the place to be. So we're inviting you to come and take notes and meet Dr. Yoshi Rahm from California. Dr. Yoshi, thank you so much for being here today.
Yeah, happy to be here.
Yeah, super excited. Love everything that you do. Love how you did it. It's so interesting. First off, why don't we introduce you to the crowd? Tell us a little bit about yourself and how you got into ozone therapy.
Yeah, family physician, started my own practice in 2011, right out of residency. Quickly became a local integrative family physician, and the practice has grown a lot since then. And completely organically, it's been just a beautiful journey, so many learning experiences. And I got in, first I learned about ozone actually through the idea of prolozone injections. I'm not sure if you have other speakers who have mentioned that thus far, but it's basically an injection of ozone, maybe a couple other medicinal qualities in there, but mainly it's ozone injected into joints. And I wanted to do that for my father actually, because he had severe osteoarthritis of both knees and had kind of been through the traditional rigmarole without much success, and he was looking at knee replacement. So that's how I learned about ozone many years ago. Well, I say many, it's all relative, right? But 7, 8 years ago, 9 years ago. And then I through the years, I'm always learning more and more, right? It's what tools can we add to the toolbox, because there's no one magic silver bullet for anything. I haven't found it, at least. And as I learned more and more about ozone and how it could be used, I picked up on this EBOO, the extracorporeal blood ozonation and oxygenation. It's quite a mouthful for me to say. And the reason I looked into that was because when the pandemic came, when it started, my mother-in-law, whom I completely adore, and I want to stick around for a long time, she was actually diagnosed with idiopathic pulmonary fibrosis 4 years ago. So that would have been somewhere around middle of 2017. And traditional medicine does not have a lot to offer individuals like her with that particular diagnosis. It's a slow scarring of the lung tissue until you basically suffocate to death and die or get a lung transplant. She's actually had a brother who passed away from it. She has another sister who's been diagnosed after her, but is actually doing way worse than her currently. So there's a huge actual genetic familial component to her situation. And through the use of regenerative medicines, starting 4 years ago, we've been able to completely stabilize her situation. So, but when the pandemic started, I asked myself, what else can I add to the toolbox to support her in case she came down with a particular virus? And how could we protect her lungs? So I had previously been exposed to EBOO and its concepts, but at that point it was go time. And so at that point it was learn as much about this so that I can have it in the office should she need it. And then of course, patients would benefit as well.
Very cool. And the thing that's interesting is that, and I want everybody to really pick up on this, is that you started out by saying the exact same thing every single speaker on here has said, and actually all my ozone events, this is a tool. It is not the magic bullet. Everybody wants that magic bullet. It's not. You got to look at the big picture and put it all together. So I'm so glad that you said that. And I didn't warn you. I didn't tell you to say that. That just came out of you. And that's a true healer. True healers understand that. So everybody's listening. EBOO is a really fantastic therapy. I'm excited to introduce you to the system through Dr. Yoshi, but do understand, you got to look at the big picture and address a lot of different things here, right? Okay, so that said, and no medical claims are being made here. We are here just to give you information on educational basis. We always say that as well. Okay, so getting into EBU, what is it exactly? So it has a long name, of course, but what is the whole therapy? Walk us through.
Yeah, so the idea behind EBU is basically it's extracorporeal, so it's outside of the body. That's where the therapy is actually taking place, the initial part of the therapy, blood, ozone, and oxygenation. So we are pumping blood through a system and adding outside of the body, we're adding ozone and oxygen to the blood. And then that blood is being pumped back into our bodies. So
right,
would you like me to?
Yeah, you have your little demo there that we've kept off camera, but now we're going to bring it on camera. It's not a demo type class, but it's just such an interesting setup that on this particular session, I wanted you guys to see it. We did it with Dr. Peretti last time, and Dr. Yoshi is going to walk us through this time. So those of you guys who are professionals, you could see how it's set up. If you have questions, Dr. Yoshi will be more than happy to answer. Just send them to me via email or through this class, and we will take care of you. Those of you guys who are watching as patients or clients, understand it so you see if it resonates, you think it's something that could help you. And we'll talk about that in a little bit as well. How do you know that this could help you, right? Okay, so walk us through a little bit about the setup. And this is only one portion of it. The other portion, of course, is the ozone machines, and they have to be special machines. And you could talk to us about that. But walk us through how the setup is and the procedure so people could understand. Because it always, to me, looks a lot of tubing coming out all over and looks kind of scary.
Yeah, it's not a very simple setup. The principles are simple, but all these tubes and machines can get a little bit complicated, especially in the beginning. If you are a practitioner who's learning to do this, you really do want to have some high quality training. And so the system is actually being used right now, so I don't have the pumps, but I like to think of this as kind of a horizontal system, loop system, and a vertical loop system. And so we have this filter, and this is where most of the action is occurring. And in through the top comes the oxygen ozone gas. So at this end of the tube would be the ozonation machine. Comes in the top and it comes down. So this is the vertical loop. And we actually have a suction coming out of the bottom here. So right there. So there's actually suction pulling it out. Now, while the ozone is going down, we have the blood going up. Okay. And so we have blood coming out of one arm, say my right arm, for instance, coming in through the bottom, up and out the top through this air filter, which catches any air bubbles or oxygen bubbles that might be present. And then that freshly minted ozonated blood is going right back into the other arm, my left arm in this example. Now, inside this filter, I actually cut one of these open. It almost looks like a big hairbrush.
Oh, that's very cool. Can you hold that real close to the camera so we can see that?
Let's see here.
Yeah, there we go. Oh, wow. That's very cool.
Hairbrush. Now, each one of these little tiny, you can't even see this probably, but each one of these little tiny, it actually is hollow inside.
Hold on, let me just put it so that everybody else could see it. I just want to see it.
Yeah.
Okay, go ahead. Hold it up again.
So we have
right.
This,
gotcha.
all these little tiny, and each one of these little microtubules is actually hollow inside. So it's like a hose with a bunch of little holes in it. And that's how the blood can go up the system on the outside of these little microtubules, but through the center of each one of these little microtubules, the oxygen and ozone is going in the opposite direction. And that's how the blood is basically being bathed in the oxygen and ozone mixture.
Okay, so now I have a question that I love the way you broke it down. That's so cool. As the blood or as the ozone is coming in from the top, and then you said the suction is through the filter. So that whole filtration system, I didn't realize. I was thinking in my mind like a water filtration system, but nothing even remotely close. This is totally different. So those tubules now are taking the blood once it's ozonated and filtering it. And how does it take the impurities out? Because I'm hearing with Ubu, it could take all these different impurities out, but does that whole system actually separate the impurities from the blood, or is there something else I'm missing?
Yeah, so the vacuum system will actually pull out at the end of our sessions. We usually have these big liter bottles, and people will have anywhere from, it might be a fourth full to half full of fluid and foam. And there's definitely some debate about what's in there. I actually have a couple of samples out to a lab right now because I want to know as much as possible.
There is a lot of controversy about that. You know, they're saying, because I've heard ozone, and we need to talk about this because this is a masterclass and we want to go deep right away. So there's a lot of controversy about, does ozone have the ability to go after heavy metals? Can it really get rid of all these toxins that are in our system? Does the EBU really filter that out? Like, how do you know? And every person that I know right now is looking to test what is the residual on that, because everybody's now like, is it true? Is it really that what's coming out? So when do you get your results back? We want to know.
Yeah, I will definitely follow up with you for sure.
Right.
Maybe I can add it into the presentation, the results, and hopefully that can go out at some point, because I'm all about sharing the info. I almost don't even want to say too much right now because I don't know. I don't know what I don't know. All I know at this point is the kind of results that patients or clients.
Well, then let's talk about that a little bit. Yeah, the results and the benefits. I mean, that's what we love to hear as well. It's like, okay, that's a great procedure, but what does it really do for the people? So talk to us a little bit about what kind of results you're getting, what people are saying after they've done, and how long is the procedure, just so people kind of have an idea.
Yeah, good questions. So first, I just want to back up. I don't actually suspect that we're filtering out heavy metals. I don't want to make claims that I don't know for fact are actually happening. So
yeah, I'm in agreement with you. Just to say, Dr. Yoshi, I'm going to jump on your bandwagon. I agree. A lot of docs say that it does. I don't see that, you know, as being, yeah, I think there's a whole, but because I studied with people who had studied with Dr. Klinghardt, and he had many procedures to not only test for it, but how to get rid of it, especially when there's been amalgams, you get rid of that. The mercury is insidious. Like, there's many things that need to be done. And to say that one filtration system can get rid of mercury toxicity or heavy metals, yeah, I'm with you. I'm a little bit skeptical, but proof is in the pudding.
Yes.
We will see what happens when all the docs like you give us back the results. So yeah, it's fine. So let's go back to the procedure and what you're seeing people are getting results, because that's something that, of course, people are very eager to find out.
Yeah. So in our office, once you actually get hooked up and the ozone is turned on, you're on there for about 40 to 50 minutes, kind of depends on the person. You always want to come hydrated, really well hydrated, because we have 2 lines going into their bigger catheters. It's not a painful process, but it's just important to be really well hydrated for this process. The blood flows easier, there's just less complications. The other thing is, if someone is not metabolically flexible, then—
Wait, hold on. What does that mean? What is metabolic flexibility? Explain that for everybody.
Yeah, basically meaning if you are someone who is susceptible to hypoglycemia or low blood sugar, or just drastic blood sugar fluctuations, then we suggest that type of individual actually eat a moderate, healthy meal before coming in, an hour or 2 before coming in. That has completely taken away any of the hypoglycemia that we were seeing in the beginning. And people are great as long as we cover those couple bases. Hydrate and eat if you're not metabolically flexible. Many people who are familiar with intermittent fasting, they don't need to eat beforehand. Myself, I have a pretty good metabolism. It's very healthy, robust, and I do fine without eating. That is not typical of someone who's in the more sick bucket.
Right.
So you asked me what kind of results we're seeing. I'm just going to go back to my mother-in-law as kind of case number one, because it's the reason I got into it. And her oxygen saturations, whereas 4 years ago, she was right around 93, 94, 95, basically call it 93 to 95 on average. She's actually at 96 to 98 on average. So to see a quote, irreversible condition actually have some kind of reversal according to the oxygenation is profound.
And just so everybody knows, because we do have people who are not professional and don't know a good range for that. So she was down in the low 90s. Now she's up in the higher 90s. Like, what is the average range for oxygenation, just so everybody knows?
Yeah, a really healthy person right now, I'm probably 97 to 99.
Okay.
So she's really just pretty much pushing that healthy person, which is incredible. Again, she's someone who her brother has already passed away from it. Her sister, who lives in another state and does not have access to this type of medical care, she's deteriorating. So it's a very obvious example of just how much this type of therapy can help be one huge tool in the toolbox.
Yeah, for sure.
I'm going to go to patient number 2, who is my mom. She has chronic Lyme, has had it for probably 40 years now. And after her, now she also does not live locally, so she's only received one of these sessions. She has horrible sleep. I think it's largely due to a lot of inflammation in her system. And she had one session and she got 8 hours of sleep for the first time, she said, in probably 20 years. So something good is happening there. Right before this call, I was just kind of going over with the nurse some good examples, and she just pulled up a couple days ago. We had another individual who has severe cardiovascular disease, including 5 stents in the heart. And apparently after doing just one session of this, his cardiologist actually called him flabbergasted that his inflammation markers, his hsCRP, which is one of many possible inflammation markers, because it was lower than I guess he'd ever seen. That's the report that came to us.
That's what I've heard as well, that this EBU is really good for cardiovascular issues. In general, do you find, Dr. Yoshi, that from your clinical experience that there's certain types of patients that seem to do better with it? I have heard about the cardiovascular issues. This is very good for that. Other things that you have seen clinically, what do you find?
Arthritis, brain fog, chronic fatigue. Those are huge ones. I think that any situation that involves too much inflammation being in the body, I think this is something that ought to be on the radar as a possibility. That's because you think about it: idiopathic pulmonary fibrosis, chronic Lyme, major cardiovascular, rheumatoid arthritis. I mean, all of those, they have inflammation in common.
Yeah, no, for sure. And then the thing is too that if they see a difference in that first session, it's easier to start working with them on all the other facets of their diet, lifestyle, and whatnot. So that is really nice to be able to take their inflammation down quite a bit. Do you find that people like that need a lot of sessions? Like, people will say, well, how many of these do I need? Do I need 20 sessions? And of course, everybody's different. We know this, but just to give us an idea, like how often do they need to come in and how many sessions typically do you see are needed?
Yeah, that's a really great question and a great differentiator, because with a lot of the ozone therapies, I think of it kind of the milder the ozone therapy, is, the more often you're going to need it. I think this is currently, and in the future, I'm sure something better will come along, but I think currently this is kind of the creme de la creme of ozone therapies. And what I've found is that you need much fewer therapies. Whereas somebody might need a major autohemotherapy session, MAH, once a week or twice a week, even maybe a 10 pass once every couple of weeks. It's in my perception is that the majority of the effects from one of our EBU sessions lasts probably 4 to 8 weeks. And so if somebody's really, in the throes of an illness, yeah, maybe doing one every 1 to 2 weeks for a couple sessions, but then I find that people can really start lengthening those out to where they only need it once a month or once every 2 months. For someone who's really healthy and just kind of wants to do it to optimize things, once a quarter, right? So I think that's a really beautiful situation, and shows the power, the healing potential, I'll call it, of this type of therapy.
Yeah, and that's what I'm so excited about EBU. When I just found out about it last year, and I've been a naturopath for 30 years. This EBU's been around for how long? And I just found out about it. So I'm like, well, I'm going to put this on the map. And so that's why I'm so grateful that you're sharing this, because EBU, like you said, is the creme de la creme. It is like, you don't need that much. It super oxygenates the blood. It's just like, just way, way up there, which I love about it, because we don't really want to go every week. I mean, yes, if you're in pain and you've been having chronic issues, I get it. But it's like, look, tell me what to do. Let's get the lifestyle changes. Let's understand what we need for foods, and put the whole thing together. So this is a really great therapy to put in people's toolbox. One of the questions I want to deep dive in with you, Dr. Yoshi, is about afterwards. Do you find people afterwards? Because I had it done here in Florida, and I felt, it wasn't tired, but it was like a very like, I don't know if I want to sleep. I was relaxed. It was like, because all of us are inflamed at some point. And I was like, I think my inflammation went down, and I slept really good that night. And I don't, and I was like, wow, that was the deepest sleep I've had in a long, long time. Like your, I think you said your mom.
Like my mom, yeah.
Yeah. So are you finding that people are getting any after effects? Are they herxing? I've heard sometimes people are concerned about that. What are you finding is happening after? Like, is there anything negative that people need to be aware of?
So my experience in our patients is that herxing is very minimal. Now, sorry, excuse me, I'm getting one question. Okay, sorry about that patient interruption. Herxing has been very limited in my experience. Number one, I think we always, if someone comes in and they have mold and there's this real potential for herxing, we'll use some of the other modalities to help prevent that. But this is a really gentle, the way we do it at least, and I think because this is a new therapy, I think the practitioners around the country who are doing it are all doing it a little bit differently. I definitely believe that and know that, suspect that to be true. So, sorry, lost my train of mind there.
That's okay. So what you're saying is the herxing is very, very minimal, which I like to say that when people are doing ozone therapy correctly, which I know you are, it's a slow process, right? And you work with the body. And then you mentioned something very, very valuable. If someone is super toxic, like with mold, perfect example. Oh my gosh, when they're full of toxins with mold, then it's super important that you do other things to get the body ready, right? And then when they do EBU, it's like, okay, the body can handle it. It's like, we're getting rid of all this stuff and you're going to feel really good. So that's what I'm finding. All the experts are saying the exact same thing. So Herxheimer, let's explain Herxheimer for those who don't know, but then understand that when you go slowly or you prep the body in other modalities, it's very minimal. And that's the way it should be. It doesn't have to be this massive, oh, I'm going to get sick for a week. No, it's not necessary. So let's let's define
Yeah.
first Herxheimer, because I know some people don't understand it.
Yeah, Herxheimer's basically is toxins coming out of the body or being mobilized too quickly. And then, if you have a little bit of mold toxins in your body that are sitting in an area and you stir up the pot, right? They're going to go into the bloodstream and then go all over your body rather than being localized. It's suddenly all over your body, including your brain, and then you have more fatigue. And so there's just a plethora of further symptoms that you might have been trying to run away from to begin with. So starting any therapy in a thoughtful way, I think, is always important. And one of the huge benefits of the EBU is that it's ozone given at a much lower dosage, so lower gamma. And I believe that that's much easier on the system compared to a 10 pass where you're doing higher dose gamma. And it might just be pressing on the NF kappa beta side of the equation. So when you get severe oxidation response, it just turns on inflammation, right? Versus a lower dosing of ozone probably turns on more of the NRF2 pathway, which really revs up the antioxidant. And so there's this beautiful balancing act that goes on. It's also something to be cognizant. Anybody who's doing ozone therapy should be cognizant of this, because too much of a good thing, bam, is not a good thing, right? And so if we're revving up the inflammation system too much, you're not going to feel good no matter what. And so I think going slow and again, just paying attention is so important with this type of therapy.
Yeah, and that's why I love talking to you, because you're the type of doc who like really pays attention to your patient. You watch what's needed. You're not pushing too hard. How much, just out of curiosity, how much gamma is used for the EBU process?
So it depends on the patient. In my practice, it'll be anywhere from 1.5 gamma up to 25 gamma. Actually.
Oh, okay. All right.
Yeah,
So so not a huge amount. So that's really cool. Okay. So talk about,
but it's flowing in over the full 45 minutes. Right.
Right.
And then you can adjust the pump speed as well.
Oh,
so
what does that mean? Like if you adjust the pump speed, what does that entail?
I think it's just gonna, if you have, wish I had my pump here. But if you have the blood kind of trickling through ever so slowly while this ozone is coming down and ozonating it, it's going to be, well, ozonated to a certain extent, versus if you have blood that's rushing by very, very quickly, right? The same amount of ozone being pumped into the system, you're going to get a different response.
Oh, gotcha.
Right? So there's these two variables there. And then the filtration system. And again, I would pay money right now to know exactly what is in that filtration system. But I will say that anecdotally, the sicker the individual, the more, right now we're just calling it gunk, will come out in there. Now that's a very anecdotal and a very rough estimate. So again, but
not making any claims here,
not making any claims, exactly.
But you can see the blood on the tubing. Like, I don't know if it's on your website, but I've certainly looked it up, that on one arm, you'll see the blood leaving and it's dark red, sludgy, almost like ruby red. And then the other, by the time it's ozonated and gone through its filtration, it's very light. And like you could tell, it's like, oh my gosh, it's like dirty blood, clean blood, right? That's how it looks.
It's beautiful. It's beautiful. I have a picture of my own arms on there on my
website.
Cool. Yeah.
Okay. Yeah. Very cool. Okay, so that is all important components for people to understand that the herxing is not that big a deal on this as well, because you're using a smaller amount of ozone, you're going slowly, and Doc Yoshi is taking care of you. So that's a big deal, right? And the other thing you mentioned earlier is about modalities. So what are you finding as far as what works well with this? Like, do you do things, looking at the big picture with people of what modalities can work well as they're using the EBU? Like, what has been your experience with that?
Yeah, and back a few minutes ago when I got a little bit distracted by the patient. You had asked me what people are experiencing afterwards.
Oh,
I
right.
would say 2/3 feel a kind of a light, energized feeling, a little bit more clear-minded, maybe even almost floaty or a high, but it's like a good clarity, clear feeling type of high.
Mhm.
And probably the other third can be tired. It sounds like almost like the experience that you had, where they'll be tired for that day, possibly the next, but then there's kind of, most people have reported a kind of rebound where the next day or even 2 or 3 days later, suddenly they have even more energy than they had before the therapy. So
Mhm.
that, just to touch base on that,
Sure.
that's what people are feeling afterwards. Haven't had anybody feel bad afterwards thus
Yeah, no,
far.
I haven't heard that either. And those are two things that I've heard as well. So how do you use different modalities, or so the professional is going to want to know, because many professionals use different things, right? Some use
Mhm.
PEMF and microcurrents and biomats and saunas and all these different things. And then of course there's nutritional IVs and that whole space that people are starting to look into. So with Ibu, do you find that there are certain things that work well that you have put together for people so that they understand that, hey, it's good to mix it? Or are you finding, no, just put them all into Ibu and we're good?
Yeah, excellent question. Again, this is one huge tool in our tool chest, but we, at my office, we do nutritional IVs, including Plaquex or phosphatidylcholine. I'm a big proponent of that being another modality to use, especially
Okay,
in
wait, pause
cardiovascular.
that, Dr. Yoshi. Wait. Phosphatidylcholine. I love that stuff ever since I was introduced to it a couple of years ago. Explain to us, for the layperson, I'm sure the professionals know it, but this is like a really big deal. And I'm seeing it help so much with brain fog, people who are starting to have dementia, that kind of stuff.
Yes.
Explain to us a little bit about that, because I think it's important to know that when you mix that with ozone, wow, that's a great combo. So say it again,
Yes.
because I can never say it straight.
Yeah. So phosphatidylcholine is, you can take it orally, you can do it intravenously, and the cell membranes, so that is the layer around each cell, has a lot of phospholipids, has a lot of different types of fats and molecules in it, but a major component is the phospholipids that are in those cell membranes. And with time, that phosphatidylcholine either becomes less or old. And so if we can replace it, basically we're doing, I think of the IV phosphatidylcholine as an oil change. It's an oil change for your cell membranes. And suddenly when cell membranes are happier and healthier in your body, they can communicate with each other better. And so, yes, you mentioned dementia. We're a family medicine office, so we see newborns to the elderly, but we also, in addition to the regenerative oxidation therapies, we also have a large population who we are working with their cognition and brain health with. So number of modalities, but this is a huge, those two are huge. I think anybody with dementia probably is a good candidate for considering Ibu. Definitely the phosphatidylcholine as well. So, but what other modalities? I mean, that's such a, I like to go back to basics with everyone, right? And very few people are doing the basic tenets of a healthy lifestyle consistently, 6 out of 7 days. Nobody has to be perfect, but going back to those basic healthy lifestyle tenets is paramount for any treatment, because if someone's not doing those things or most of those things, you can come in for a fancy treatment like our Ibu, and it's going to have a great effect, but you want more time, you want more bang for your buck, you want more bang for your time, right? And so it's the whole picture.
Yeah, and I really appreciate you saying that, because it is the whole picture. People need to understand that when they really lay their foundation of their healthy lifestyle. And many people, when I was in practice and had my clinics, people will come to me just to stay accountable, just to stay motivated on their program. But then we also did the therapies, right? And that was a really nice combination. The therapies took them out of their really bad pain and to help move the needle. But man, that's the word. That's the word right there, Dr. Yoshi, is consistency, right? Really get in that consistent zone and work with somebody like yourself that can keep you in that zone, because that's where the real results come in, right?
Yeah, absolutely.
Yeah, cool. So, okay, so you mentioned you got some great results with people and you have a family practice. So you really go from A to Z, from baby to older people. If people want to, now I know the other thing I really enjoyed talking to you about is that your prices are reasonable. You don't gouge people, and people literally fly from all over because EBOO is a very expensive treatment. And there's a lot of reasons why. The machine is not cheap. We get it. But you could work with somebody like Dr. Yoshi, who's like, hey, man, I figured it out. We're not going to gouge you. And it's a very, very reasonable therapy the way you have set it up. So if people want to come to you, what's the first thing they do? Do they get on your website, make a call? Do you do virtual calls? Tell us how you do this.
Yeah, get on our website. It's www.dryoshi.com. So that's DRYOSHI.com, dryoshi.com. We do telemedicine, and you want to call us up, get on our schedule. There's myself, we have another family physician, integrative as well. We have a family nurse practitioner. We have amazing IV nurses. Actually, my whole team here rocks. We do a lot to increase our vibe because that's what is a huge part of healing. So the higher we're operating, the higher potential there is for our clients to improve their health. Great health coach as well. You mentioned that. So hop on our website and come check us out.
Yeah, very cool. And where are you located, Dr. Yoshi?
We're in North Glendale in the Los Angeles area.
Right, that's called California, you guys. So you're not even near California. You'd be like, that's too far. Listen, you're going to want to hop on a plane and go see Dr. Yoshi. I mean, I don't often say that, but I'm saying it this time. I mean, if I was struggling with something, I'd be on the plane to go see Dr. Yoshi, right? That's how strongly I feel that he knows what he's doing. He cares. There's nothing like that. There's not a lot of people you could say that about. Unfortunately, even in our industry, it's really sad, right? But Dr. Yoshi is very dedicated and he wants to help you guys. So get a hold of him, get on his website. But here's the thing, all of you who are watching, listening, whether you're professional or not, Dr. Yoshi, we want to make it very clear, does not do the training on the EBOO. He really just sees the patients. That's what his jam is. He wants to help you get better, right? So if you have questions and say, I don't know, would EBOO be good for me? What about my family member? He's not going to be able to say specific, but a good overview after talking to him. Set up a telehealth appointment with him and then, or his staff, and they will say, oh, this would be something you would want to consider, right? So I always encourage you guys, if you have questions here, we'll pass it on to Dr. Yoshi, or just go directly to his website, call him up and say, hey, I'm like thinking this EBOO might be my thing. He'll take care of you. Okay. So Dr. Yoshi, I really appreciate you being here, talking with us, sharing your expertise, especially learning more about EBOO. It's very cool. And if you're game, we want to play a game with you at the end. Is that okay?
Awesome.
You got kids, yeah?
I got three little kids, so I'm good with games.
Yeah, we're getting you ready for the real thing. Okay, so 3 quick questions. Number 1, fill in the blank. Your favorite food is?
Thai food.
Thai. Okay.
Food.
What kind of Thai? Like, what's your favorite jam?
The basil eggplant. And my body probably doesn't even do well with eggplant, but I love basil eggplant.
I know, that is my favorite too. I'm not supposed to eat eggplant either, but oh my gosh, you're so right that I don't know what they do to that. It's so yum. Oh my gosh. What was the last fun thing that you did was?
Go trick-or-treating with my 3 little children. I mean, you can't, like, You can't top that. They're just
Oh no.
so flippin' adorable.
And did you get dressed up too?
I did.
Oh,
Yeah.
how funny. And what did you dress up in?
I was Zeus.
And what were your three little minions? What are they dressed up in?
The 2-year-old was a doggy. We had a giraffe, was the 6-year-old, and we had a leopard for the 4-year-old.
Oh, so cool. Oh, that's just adorable. That was so much
Yeah.
fun. Those are the days. And it's so nice to hear that you're spending time with your kids like that. And so the last question is, what was the last thing that you did that brought peace into your life?
My morning meditation, qigong, grounding routine. Just today, every morning I go out, wake up. The first thing I do is have some hydrogen water, and then I walk outside, no matter whether it's cold. Now I'm in Los Angeles, so how cold can it get, right? It's easy
Right.
to say that. But no matter the temperature, even if it's raining, though it does rain on occasion here. But I go outside, just bare feet, and do some qigong and give thanks.
Wow, qigong is pretty cool. I really admire people who do that. I think it's a pretty powerful thing to do. So there you are, self-care, bringing peace, starting your day out right so you could give back to others. Yep, Dr. Yoshi, thank you so much for all that you do to help humanity. Really appreciate you.
Thank you for what you're doing. I mean, it's such an honor to be able to share on your stage, on the stage that you have, because it's all about lifting everyone up.
Exactly. It's all about informing people, empowering them. Absolutely. So everybody who's been on here, thank you for watching. Take notes, get a hold of Dr. Yoshi and his team if you're interested. In the meantime, get ready. We have more expert speakers coming up. We'll see you then.